Hello, my name is Amy Rojas, and my presentation is about asthma. There is three different types of asthma: seasonal asthma, mild asthma, asthma all year long, but I'll be talking in general of asthma. In the image here, you can see the normal airways of someone should have, and someone that has asthma, their airways are like this bottom image. Oops, sorry. Risk factors. There are a couple of risk factors that can cause asthma, such as family history, that your family has, your grandparents, your parents have asthma before, so it was passed to you. Viral respiration infections, such as that you were sick prior, cold, flu, and you developed the asthma. And allergies, such as the pollution, flowers, pets that you are around and you're allergic to them and causes you asthma. Uh, Occupational exposure, such as chemicals that you use in your workforce or in your environment of daily uses. Secondhand smokers. So someone in your family, a friend, a relative smokes and you breathe that, that's very bad for you and you could develop asthma. And the air pollution that we're around, we use cars. Cars gives a lot of pollution. Factories give air pollution. So those are some that could cause you asthma, and obesity. So if you're overweight, that can also be a risk factor for asthma. So decrease of a risk of asthma. So really, there's no way to go around it. There is some ways you could help to not cause it, but it's like there's no curving way. So for pollution, you could go live to some place that there's no factories, you go on your walks rather than a car. But if it's not the factories, it could be the dandelions, it could be the sunflowers, it could be something else that could give you the allergies. So there's no way to go away from that. Fatty foods. Well, yes, you could be living a healthier lifestyle, but I know everyone craves fatty foods. Smoking, that's definitely something you could avoid, as there's hotels that are non-smokers. So there is apartments, houses that are non-smokers, and relatives that don't smoke. So that is one way. So thus, there is vacuums for you to use to vacuum your carpet, that actually help, that it's not cause your asthma to react. So there's a way around this. Household chemical items. There's definitely items that tell you that are good to use if you do have asthma. And pets. Pets are a big no, such as cats and dogs, because those give you your allergy reactions to trigger your asthma. So in this image right here, you can see the normal image of an airways. So here's the area where your air would be going. You can see how this is a normal one. This is the basal membrane, and here is the basal membrane of a person who has asthma. It is swollen. And we also see on top of here, we see mucus. So there's mucus built up through the airway that doesn't let you breathe properly through your lungs. And you can see how the structure is very bad and it's very swollen and dense here. So we have a small video. It would be 14.
Airway remodeling. Here is an image from the Robbins textbook of pathology, showing a part of a normal airway. This image shows the airway of an asthmatic patient. See, there is a thick mucus layer on top of the respiratory epithelium. And there are eosinophils in mucus. Number of mucus glands have been increased to secrete more mucus. The thickness of basement membrane is also increased. Lamina propria is flooded with large numbers of neutrophils, and there are more blood vessels. Number of smooth muscle cells are increased, and they look hypertrophic. The number of glands within the submucosa is also increased.
And that was an overview of what I just mentioned. So, symptoms and physical exams. So, symptoms for asthma, they are wheezing, frequent coughing, shortness of breath, and tight chesting. So, wheezing, it would be like a little whistle that you hear when you breathe. You will hear a little small whistle, but it's very, very light whistling. Frequent coughing, so as you talk, you probably might cough as you talk because your lungs are not getting enough air inside. Shortness of breath, meaning as in you don't feel like you could take a real deep breath. It gives you a shorter one and it's supposed to be bigger. Tightness of chest, so you're feeling really much pressure, like someone's pushing you down. So these are things that the doctor would be looking for you in a physical exam. So an evaluation at a physic exam, your doctor will use a stethoscope to hear your chest for the wheezing as the whistle as you take your deep breaths. So as you take your deep breaths, as we go back to that, they could see how much of a deep breath you could take and if they hear the little whistle. In case they hear any symptoms, they will give you some medications such as a portable inhaler, which we can see here if you're an adult. If you're a younger child, you would use one of these. Sometimes even if you're an adult, you would use a machine like this or this for a kid. They would give you antibiotics. For personal experience, the antibiotics I use as my asthma treatment is the Montelukast. That's what it's called. So these are the three types of ways of how to calm your asthma when it's starting to be triggered. So these are a couple of things I got off some articles. So the process of an adult asthma is not well described as that the chronic obstructive pulmonary disease. Although a complete remission is possible to the remission rates are low and limited to mild cases, permitted lung function impairment develop in some asthmatic patients and risk an increase in smokers. The prevalence is approximately 25 million Americans have asthma. This equals to about 1 out of the 13 Americans, including 8% of adults and 7% of children. So complications you could come across if you do have asthma is you could die for not having enough breathable airways. So you're not getting enough sufficient air, so you'll probably suffocate and die. The other one is if you don't treat it right away, your asthma, you could have an asthma attack, and that's very hurtful. You could also have complications of sleepless nights, as in like when you're trying to sleep, but you can't really take that deep breath and sleep very calmly. That will cause you complications, and you'll have sleepless nights. And seasonal changes. So many people during seasonals, some of them enjoy the season change, and people who have asthma don't really do because they'll have their asthma being triggered from these seasons being changed. So in the US, the difference between men and women, in an article I found, as adults, women have an increase of asthma prevalence compared to men. Further, women are more likely to have severe asthma at a later onset asthma compared to men. So that's in adults. But in children, there's actually backwards. Younger boys are more to have asthma than younger girls. And it changes when girls hit their puberty. So that's when it starts triggering more women to have more asthma. A brief description of the current research that we have of this is that some of the current topics of the American Lung Association founder research investigating include understanding of the immune system role in the asthma effects of mold and severe asthma, improving treatments of severe asthma in children, studying genes, and the role controlling the immune. And that was from the article of the American Lung Association. There's also being research, like there is 25 million Americans diagnosed, so 1 out of 10 children have asthma. It is costly, very costly. There is 3,168 deaths and 13 million missing school days because when these students have asthma, they miss school because, again, pollution, carpets, many things that trigger the asthma. And for those adults, 14 million miss work. So many people do have limited physical activity because they're asthma, but they can be using their inhalers. But if many people can't afford the medication, they're very stuck and very limited to their daily activities. And this is my resources of where I got my information. And thank you so much for listening. I appreciate your time.